So much of what we do during the holidays involves fire, whether it's cooking, candles, or those fireplaces. Coming up today on the Morning Medical Update, the dangers to avoid in your home, including space heaters. We'll take you live also into the state-of-the-art chamber treating wounds and carbon monoxide poisoning. Good morning. It is Tuesday, November 29th. I'm Jessica Lovell. We are live inside the Dulcie Simons Jr. Family Broadcast Studio. The American Red Cross reports holiday fires kill more than 500 people and injure more than 2,000 each year. And just recently, as you may have heard, comedian Jay Leno suffered serious burn injuries. We explain the off-label treatment that he used to heal. Make sure you get your questions sent in to us this morning on YouTube, Facebook, and the Medical News Network. You can find links to all of those right there on your screen. Jay Leno is out of the hospital after a gasoline accident. The former Tonight Show host underwent surgery for second and third degree burns on about 7% of his body, including his face, chest, and hands. Leno received temporary skin grafts and underwent hyperbaric oxygen therapy. Hyperbaric oxygen therapy isn't typically used on burn patients, very specific type of burns. In fact, our expert, Dr. Dhaval, Bhavsar, medical director of the Burnett Burn Center here, joins us this morning. Good morning to you.
Good morning.
Always good to see you and talk about this topic. So what is this type of therapy typically used for?
The most common uses for the hyperbaric oxygen treatment include diabetic foot wounds, seasickness or the deep sea dive related kind of sickness, certain infections, radiation injuries, and those are the most common. Most hyperbaric treatment chambers will be used for indications like diabetic foot ulcers and radiation.
So we're going to take you inside and show you exactly how this therapy works and what it all looks like. But we said at the beginning here at the program that hyperbaric oxygen therapy is off-label use. What do we mean by off-label use in treatment?
Okay, so the indications for treatment are decided by various kind of agencies. In this case, Centers for Medicare Services have indications for use of hyperbaric treatment, which are covered by different and like all types of insurances. Burn treatment is not one of the indications that are approved by and usually will not be covered by insurance for this purpose. At the same time, physicians can choose hyperbaric oxygen treatment for the burn if they seem that it will be useful. In this case, that was done. And many times, these would not be covered by your insurance and will have to be paid.
Which then brings me to my next question. It helps to be the former Tonight Show host, Jay Leno, because you don't have to worry about out-of-pocket expenses.
Absolutely.
So perhaps maybe the doctor said, yeah, this type of therapy could be helpful. And he said, great, let's try it. And that's maybe why he ended up giving this a try and maybe would have gone through that.
Possible not being part of his treatment, I do not kind of know what that conversation would have been like. I do know that a couple burn centers do use it more commonly, but again, not having that access or not having it approved, we generally do not use it. One of the most common uses at our burn center is for carbon monoxide poisoning.
So tell me about that. If somebody were to come in, how would you know that this was that the carbon monoxide poisoning was so severe that they would need this? What kind of signs or symptoms might they be showing? Because that might be something people are worried about this time of year.
Absolutely. So someone incurring burn in a closed space, say there was an apartment fire or house fire, they were in that closed space for a very long time, they inhaled quite a bit of smoke. That smoke will contain depleted kind of air that will be higher in concentration for carbon monoxide. That is the most common way people will end up incurring or having carbon monoxide poisoning. Other ways is where it is leak of carbon monoxide in the early kind of season of the winter when people start using their space heater, or there is some fire, or there is some malfunctioning kind of in their kind of say heating system. So those are the most common reasons. Patients would kind of come in with as little as just nausea, vomiting, to altered sensorium, to kind of complete kind of be passing out from lack of oxygen. If we have a clear history of how they end up having burn, or they were in a closed space for a long time, we would be checking their carbon monoxide level and emergently arranging for their dives. And Dr. Orr, who is most of the times managing hyperbaric dives, and the team of our emergency medicine physicians who run the emergency dives, would be the one assessing and then deciding the plan for their dives.
Let's get to Dr. Orr. We want to show you inside that hyperbaric oxygen chamber. So let's go live with Dr. Orr and Alexis Del Cid, who can show us kind of how this all works. Good morning to both of you.
Good morning. This, Jess, is a fascinating process to watch. I'm here with Dr. Stephen Orr and two of your patients. Dr. Orr, we have Karen in this chamber, and we have Ken in the chamber next to her. Both of them are cancer survivors, and both of them have some tissue damage from the radiation, Dr. Orr?
Yes, both these patients are receiving hyperbarics for radiation-induced injury following radiation therapy.
And so when all this extra oxygen is pumped in, how does that help repair the tissue and reduce swelling?
What happens with hyperbaric therapy is that these patients are breathing 100% oxygen under pressure, and this elevated level of oxygen gets into the bloodstream irrespective of the amount of red blood cells. It's actually forced into solution, so the levels of oxygen get very high in the body where perfusion is normal. In areas which are damaged by radiation, those areas are lower, and that creates a gradient or difference between healthy tissue and diseased tissue, and that causes stem cell release to migrate to the areas where the perfusion is lower, and create new blood vessels in the area where blood flow is compromised.
So before the newscast started, before the program started, I was able to talk to Ken and Karen, but I can also talk to them right now because I think I'm going to try to talk to Karen. There is a phone here that I can pick up and talk to her on the other side of the glass. She's watching The Departed right now, by the way. You get to pick what movie you watch. It's an 80-minute treatment. Good choice. So I'm going to see. Hi, Karen. How's it going? She says it's going great. What does it feel like in there right now? Anything special? Anything different? Nothing different? Like in an airplane. Okay, so she says when it first starts up, it feels like you're on an airplane and the pressure of your ears kind of pops and then your ears clear and then it's pretty relaxing. I'm going to let you get back. Says it takes about 10 minutes for it to get clear, for her ears to clear. The whole chamber fills up with oxygen, and then she starts to feel better. And Karen, this is your what number treatment? 18 or 19th treatment. We're going to let you get back to watching The Departed. Sorry to interrupt your movie. All right. So basically, both patients say that it's pretty relaxing. Over here we have Ken. Ken has different taste in movies. He's watching Santa Claus 3. He is a cancer survivor of the jaw, and so on the right side of his jaw right now, he's battling an infection, and that's what Ken is in the hyperbaric oxygen chamber for, getting his treatment. Karen is a cervical cancer survivor. The radiation has damaged the tissue around her bladder. So basically, it sounds pretty rough for the past 36 weeks. She says the sensation for her is because of the tissue damage. Feels like she has a UTI nonstop. So obviously she wants to go through this treatment and get that fixed, and she was really hoping that it helps and makes her feel better. Both of these patients have told us, though, before they went in that it's pretty relaxing. They don't feel anything major. I want to bring in Dr. Orr again. Dr. Orr, you also use this treatment when it comes to, as we were talking about earlier in the program, carbon monoxide poisoning. How does this work for that?
Well, the high levels of oxygen displace the carbon monoxide molecule from the hemoglobin, and in doing so, it reduces clearance of carbon monoxide very rapidly from the blood system. And if you were to breathe air, it would take about 74 minutes to clear the carbon monoxide. But with hyperbaric therapy, within 5 or 6, 7 or 8 minutes, it's pretty much completely gone. And because of that, that's one of the rare times that hyperbarics is used as a primary treatment modality for a disease process. The other treatment modalities such as gas embolism and decompression illness are often used in divers who are doing deep sea diving.
Is that when we hear about divers getting the bends?
Exactly, exactly. And that's the other primary indication for hyperbarics, where it's the standalone therapy for those patients.
And I would imagine here in the Midwest you get more carbon monoxide poisoning than divers coming in here, especially in the winter months. How many do you see patients coming in here for carbon monoxide poisoning?
We see a fair number. Actually, the times when we see patients aren't necessarily in the wintertime. It's usually during the transition from fall into winter, when the temperature will drop suddenly and the furnaces will kick on for the first time. And those furnaces may have incomplete combustion, causing the release of carbon monoxide.
Okay.
And it's often in those cases. Also, we see it during storms where people may use generators when the electricity goes out. And because of where they live, they may keep the generators in a place within the house to prevent someone from stealing it. And they run a gas generator for electricity, and it causes problems as well.
This is, again, just a fascinating process to watch. It's quiet in here. They can hear the movies they're watching. We can't hear them. There's just kind of a light hissing noise of the machines as we stand in here. And this is where the patients will be for the next 80 minutes or so is what the treatment is, and I'll be here with Dr. Orr just for a little bit longer. He's got to tend to patients, so he's a hot commodity. We were able to snag him for about 15 minutes today. I want to toss it back to you in the studio.
Really, really interesting to see that show and tell this morning, Dr. Orr and Alexis. Alexis, I was asking Dr. Bhavsar, though, our patients here this morning clearly have made appointments to come in and do this, but my question to you, Doc, was, can this be performed on an emergent basis, and in what cases would that happen?
So the most common indication for emergent dive would be the carbon monoxide poisoning, as Dr. Orr was saying. If we have a patient who arrives at our hospital with a high level of carbon monoxide level, it would be immediately kind of alerting the teams that are involved in the care, be it burn team, any critical care team, and emergency medicine team. And as long as patient is stable for a dive, we would be asking for emergency medicine physician who is covering the HBO treatment or the service will be kind of getting ready to dive these patients. They will be they'll immediately, and then they will have at least 2 dives in that first 24-hour period.
And I got to sneak this in here because you said that's what differentiates us from others in the area. We're the only ones who do that.
Yes, in this area, like in the Kansas City metro area, probably we are the only one who would do the emergent dives. Most of the other hyperbaric oxygen treatment kind of programs are only the day programs, and they do not do any emergent dives.
All right, there's a QR code on your screen if you're interested in more information about hyperbaric oxygen therapy, kind of what it's about, and more information about what we are talking about this morning. I want to move on to kind of the things that we're dealing with this holiday season. We talked a little bit about space heaters and carbon monoxide. It's so scary. That's something I get really nervous about, and I know other folks do too. Let's talk about some other, though, common injuries this time of year. What's the most common, and then what are the most serious that you see?
Okay, so as the kind of weather changes and we kind of move from fall to winter, and then people would start using different modes of kind of heating, including space heaters and other types of kind of more or less systemic heating. They do kind of see the increase in the incidence of those like burns related to those kind of heating mechanisms. We also see injury in our homeless population, where they will be dependent on very, very basic heating, and it will be very proximated to their body, right? It will be very much kind of within a feet or two of their body, and then that leads to, again, increase in the burn injuries for those patients. And that is very common for us. As we can transition from October to November, those numbers will increase. Another thing is when the heating systems are restarted and being it faulty, off and on, we see that there will be apartment fires, and non-functioning smoke alarms or the fire alarms would lead to really, really bad kind of fire. And it is, as you all know, that we hear about that almost every day, that there are kind of house fires, apartment fires, and leading to burn injuries. Those are more severe ones. Usually, someone getting burned in that kind of incidents would have a larger surface air burn, will have a higher chance for having smoke inhalation and possibly carbon monoxide poisoning also.
So how do I know if I've had a burn at home that seems somewhat minor. How do I know it gets to a point where it's serious enough via maybe an infection that I would need to come in and seek medical attention?
I would say and to kind of simplify, and this is not like a perfect description, but say any burn that is more than your palm size would most commonly require some kind of treatment, and would seeing a doctor would be advisable.
So how do you treat it at home? Let's say I burn myself and it's a surface. Okay, so we have a surface burn, and then you have ones that might open. So talk to us a little bit about that.
So once you have a burn, like say if it is only like where it is sunburn, like your skin gets red, but no blistering, just kind of a little bit pain, a little bit irritation, and then eventually some scaling of the skin. That can be managed just with kind of basic moisturizers, emollients, and then making sure that the skin doesn't dry out, stays covered. You can still shower with kind of normal room temperature water to avoid pain, and just continue to do it. If there are blisters, that's when it's considered second-degree burn. Those areas where there are blisters will take longer to heal and may require care. If it's again a very small area, kind of at home, if you're treating it, you make sure it stays clean. Cover it with an antibiotic ointment or at least a good moisturizer. And if it's, again, larger than a palm-size area, it involves hand, face, neck, feet, other functional areas, other aesthetic areas. Please see kind of help from a doctor.
You'll know, right?
That's true. You will know.
Hopefully.
But I think you're right. And it's not uncommon for us to see patients who have a burn more than a week back, and that's when they would end up having, if it's a larger surface area burn involves kind of areas like hands and feet and kind of legs. It has a much higher chance of getting infected because that is more commonly used, more commonly exposed to kind of whatever is on the floor, and would have a higher chance of infection. There will be swelling, there will be pain. Again, if you have any questions, please reach out to us. We're available essentially 24/7 through our kind of either transfer center lines or our nursing lines. We'd be happy to help.
Okay. Couple more questions, then we're going to get to Dr. Hawkinson. But something that I deal with a lot is it's this time of year. My kids go outside, they forget to wear gloves, or they have wet gloves, or their hands are in the snow. And I'm thinking, how are you not freezing your hands? You're going to get frostbite. Can you get frostbite from being out for under an hour, 45 minutes, or what should we be looking for? How do you know if it's severe, or am I just being like a crazy mom?
Luckily, we haven't got to the temperature where we would seek frostbite kind of this season yet. Maybe one day we had that like really low temperature, but once the temperature starts going below kind of say 20 degrees, and definitely kind of when it gets close to the single digit, means even exposure of within like 30 minutes to an hour can lead to frostbite. Most of the times frostbite happens when people are out there for a longer period of time, skin is not protected, and on top of it, if they have other kind of issues, say if they have certain kind of vascular, like a vascular kind of disease where they do not have adequate blood supply, those kind of those patients will end up having skin injury much easily. Or if someone is, say, drunk or had some form of inebriation and is not kind of feeling the pain of that cold and will be exposed for a long period of time, they end up having frostbite more commonly. But again, if it is cold enough for you to feel that, that's the time. Once the first time you feel like it's getting that burning sensation, it may be worth coming back indoors.
Makes sense. Let's check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us with our COVID count. Good morning to you.
Yeah. Hi, how are you? Good. We have 24 active infections right now, 3 in the ICU, 1 on the ventilator, 18 that recovery period. Again, still just kind of hanging in that higher range than we would like in those low to mid 20s. So we'll just kind of see what happens, but hopefully we can knock those numbers down a little bit.
All right, Doc Hawk, there was a lot of misinformation surrounding COVID vaccines, as you're well aware. Some people did report seeing menstrual changes.
Yeah.
What is the latest research finding when it comes to that?
You know, it certainly did see that there were menstrual changes that were able to take place or could take place for women after getting the vaccine. It was really just some excess bleeding. It never led to any medical problems or anything like that, but we certainly were able to see, I think there were 2 recent new publications that kind of just showed that, yes, you did have these menstrual changes that were taking place, again, mostly related with just a little bit more either heavier bleeding or bleeding at the non-normal times, but otherwise was really not significant as far as impacting the health of that person.
All right, you just recently kind of enlightened us on Antibiotic Awareness Week. There's some debate over this next headline. A California Health Department is recommending people who are at high risk of sexually transmitted infection take a preventative dose of antibiotics. Is there a concern with that?
Yeah, I mean, certainly the biggest concern was going to be driving of antibiotic selection or selection for those organisms now that are resistant to those antibiotics that people are taking in those low doses for chronic periods of time. Certainly there's always the concern about taking any medicine and the side effects, but really here it is going to be when you have a lot of people that are just taking medicines, number one, are they taking it correctly? Are they missing doses? That is going to lead to lower concentrations. That will help drive selection for those antibiotic-resistant bacterial strains. And that is really the most concerning thing here is as we use more antibiotics, there will be some of those bacteria that are resistant. But if you have many people using them, that number of bacteria or those isolates can increase, and that is the real concern here because we are already dealing a little bit with that with antibiotic resistance, not just for sexually transmitted infections or STIs, but really all infections in general.
Doc Hawk, thank you so much. Any reporters on the line today? Let's get to our community. Dr. Bhavsar, Lisa wants to know, how do I get referred to use hyperbaric oxygen therapy? Do I have to already be a patient here? Do I need to be referred through my doctor? How does it work?
I think if you do have a reason to believe that you would benefit from hyperbaric oxygen treatment, it will be good to first talk to your physician who is taking care of either your primary care doctor or doctor who is taking care of the current problem. If you do not have one and you do think that you'll kind of need that or benefit from it, call KU's physician referral line and we will kind of arrange for kind of talking to the doctor, or if need be, then and if it's indicated, a consultation can be arranged with the physician who would decide if you would benefit from it.
Leslie wants to know, is there any risk to this type of therapy?
Again, I think currently I'm not the one doing the hyperbaric treatment, so I do not want to kind of speak out of my turn, but there are no known kind of risks that I know of once done for the right kind of reasons. In itself, I think the biggest kind of thing is that it is a very there is somewhat uncomfortable early on in the treatment, as our patients today say that first those 10 minutes or so when the pressure is increasing, it feels very kind of uncomfortable, as if you are kind of on a constant ascent in an airplane or constant descent in an airplane where there is a change in the pressure. And I think that's why most of those patients will end up having kind of ear tubes placed to make sure that it's equalized all the time.
Well, and you made a good point. You said you want to make sure you're using it. Any risk, well, that's why you make sure you're using it for the right purposes.
Right. Absolutely.
Speaking of uncomfortable, Tom just said I'm claustrophobic. Might this treatment trigger that? I would imagine so, but yes. I don't want to speak out of turn, but it looked like it.
I think that is the one kind of concern that we usually have. Patients are asked about it. One positive is if you are getting treatment in what is called a single chamber, those chambers are clear kind of material. You are not, even though you feel like you're in a closed space, you're surrounded by clear vision. You're not your vision is not obstructed. There will be an attendant or two right next to you. Or there are other types where there are what is called a multi-chamber kind of treatment centers, where you're essentially entering an open room, like a large room, and you will be sitting in a certain type of a chair or recliner essentially and getting the treatment. Depending on where you're getting, you may still be in a closed space. but at the same time, most of these are more open spaces or clear kind of vision, so that you will not be your vision is not obstructed. You will be feeling like you are next to someone all the time.
I'm so glad you and Dr. Orr educated us on this, because I think when we start, I had not seen the inside of that room. I didn't really know what a hyperbaric therapy, what this chamber, this oxygen chamber looked like. So, and when we talked to you about it, I wanted to bring you here to explain it so we understand what it's specifically used for, you know, and I just have a better understanding. So thanks for the education on that. Any last tips that we need to know as far as keeping our family safe for the holiday? Most importantly, we want to start the new year safe and happy, and things that can be avoided. What do you want us to know about that?
So whenever you're using space heaters, please be careful. Know that it's functioning normally. If you have anybody who has any disease, like say neuropathy or altered sensation or altered vascular supply or the blood circulation, those patients or those people have a higher chance of having burn injury because of loss of sensation or altered kind of circulation. That skin is vulnerable to heat. What we feel normally as hot may not be felt the same way hot or painful by person who has neuropathy, and that will lead to easier burn. And I think that is the most common reason we see burn. Two, when space heaters are kind of used beyond its capacity, there are higher chances of kind of starting a fire from that. Or if you end up having any clothing or any other material close to it, it will end up having fire risk.
I hope somebody's hearing us, because, you know, it's these little things that once you hear it, maybe it just tricks something in your brain to remember, especially when you have loved ones in and out of your house and staying with you over the holidays. And we don't want anybody to look back and feel like, gosh, I wish I would have known or remembered that. So thank you for all your tips today. And just any other final thoughts that we should know before we head out today?
No, I think every time I get a chance, please be safe. And then happy holidays.
Absolutely. Good to see you as always. I'll see you probably in 2023. That'll probably be the next time I see you. So come back.
All right.
Come back.
Absolutely.
All right. Dr. Hopkinson, final thoughts from you today.
Yeah, same thing. You know, be safe. We're always going to be promoting safe practices and prevention, most of all, so that you can try to avoid having to be seen by us here at the health system and burn docs and wound docs and all that. So certainly be safe, and again, do prevention if you're due for your vaccines, whatever those may be. Please go out and get them. Talk to your primary care physician, your medical teams, even your pharmacists, and just be up to date with those vaccines to help prevent further illness.
Thank you so much, and thank you for being with us today. You can catch our updates anytime by logging back onto Facebook, YouTube, and Twitter. Have a great day, and we'll see you back here tomorrow at 8. Meet this active woman who has something in common with rock icon Peter Frampton. They both suffer from a muscle wasting disease that threatens hips and fingers first. I'm Jessica Lovell. Coming up on the next Open Mics with Dr. Stites. The doctor who leads our neuromuscular clinic shares his research, the subtle signs of this insidious disease that mimics other diseases.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.